Midwife is a provider that takes care of women through all stages of life. We are all nurse practitioners, so we all have a master's degree and have taken the midwifery certification to become certified nurse midwives here. As a midwife means with woman, so we do pride ourselves on spending extra time with our patients, both in the clinic during your appointments and then also during labor and delivery. Always kind of being there, checking in, being there during pushing, all the way through delivery and postpartum care for those ladies. So here at Midwife Services, we provide care through all stages of life for women. So that is all the way from teenagers that are having issues with periods, birth control, those types of things, any gynecological issues through pregnancy, and then as well as after that. So for well woman exams, your pap smears, perimenopause, postmenopause, we can help with all of those things. So we're here for all women. As certified nurse midwives here with UnityPoint Des Moines, we do accept all insurances. So all care should be covered as long as it's medically necessary, such as well woman, appointments, pregnancy, all those things. So the biggest difference between coming to the midwives as opposed to the OBs is that we are able to spend more time with our patients. As midwives, we have set up our schedules to spend more time with our patients because that's what we do. That's part of why we became a midwife. All the appointments at Midwife Services will be the same in frequency as with an OBGYN. There's a standard of care where you need to be seen so many times. We do the same lab work, those types of things consistently. Your appointments with the midwives will be the same frequency as with any OB provider, whatever that or whoever that may be. You'll have appointments every 4 weeks until 28 weeks. At 28 weeks, we have appointments every 2 weeks until 36 weeks. And then at 36 weeks, you have an appointment every week until you deliver or until 41 weeks when we talk about induction. Ultrasounds are, there's 2 of them that are scheduled. You'll have an early ultrasound, usually the same day or just before your new OB appointment, and then a 20-week ultrasound that's done to check the full anatomy of baby, make sure everything's looking good that way. Other ultrasounds are available if we need to do them, if there's any concerns with growth or fluid or bleeding or anything like that. And we do have an ultrasonographer in our building that does our ultrasounds for us, as well as we have a great working relationship with perinatal services just down the road. Prenatal testing for your pregnancy is there's a new OB labs. First thing, everybody talks about how you get a bunch of blood drawn. It's not that much, but we do check all of the regular labs for that. At 28 weeks, there is a glucose test that we do. At 36 weeks, we'll do a Group B strep swab. Also, at your new OB, we have available genetic testing for baby. There's a couple of different options for that kind of. We can help you decide on those depending on your health history and insurance, that sort of stuff. At Midwife Services, our inductions are around 16% of our patients get inductions, and we really try to avoid elective inductions. Very rarely do we do those. So anything before 41 weeks for an induction is going to be something that's medically necessary. There's a lot of things that can cause that, such as high blood pressure in pregnancy, other issues maybe with baby, advanced maternal age for mom, and kind of a whole host of other things. Otherwise, once you get to 41 weeks, we will schedule an induction. We do only take care of low-risk women. So if you go past 41 weeks and 3 days in your pregnancy, then you become high risk, and we have to transfer you to the OBs for continued care. So we do inductions at 41 weeks. However, you do not have to do that. You just have to transfer to the OBs if you would like to continue your pregnancy. The C-section rate at Midwife Services of UnityPoint Health Des Moines is about 16%. The Iowa average is 23%, which has actually just come down quite a bit. There's a large initiative nationally to decrease C-section rates, so those are looking better nationally. As far as midwives as well, they've gone down. For us, obviously, we don't do C-sections, but we do have the physicians available to us if we do need to use them for assistance with a delivery such as a C-section. The midwives here in Des Moines at Midwife Services, we only do hospital births. We do not do home births. There are midwives in the Des Moines area that do home births, but we do not. We also cannot deliver in the bathtubs at the hospital. We can labor in the tubs but not deliver. We deliver at Methodist Downtown and Methodist West. We always have one midwife on call at each hospital, so we don't have to run back and forth between hospitals, so we can spend that extra time with our laboring patients. Both hospitals have the labor jacuzzi tubs. We have birthing balls, peanut balls, squat bars, birthing stools, beds that do all sorts of things that we can put moms in any position you want. And other things like aromatherapy we have available. At both hospitals, we have the same amenities. During your OB appointments, you will want to meet every midwife if you can. At least one time, because it'll be whichever midwife is on call at whichever hospital you're delivering at that will be with you through your labor and delivery. Whether your desire is to have a natural unmedicated childbirth or you want to have pain medication, we can provide and support both of those options for you. In addition to having all of the peanut balls, labor tub, all those things to try to get you through your labor and delivery without any medication, we also can do IV pain medication as well as epidurals provided by our anesthesiologist at both hospitals. Either way, we're here for you. Whatever you want is what we want. So don't feel bad if you want an epidural, and if you want to do an unmedicated birth, then we're definitely here to support you and help you get through that.